Welcome to All Home Care Matters, the show where we discuss all things home care, with discussions on important age-related matters and topics. Brought to you by Enriched Life Home Care Services, the #1 rated home care provider in Michigan by Top Rated Local.
Hello, and welcome back to All Home Care Matters. If this is your first time visiting us here at the show, we want to say thank you for taking time out to be with us today. We appreciate how valuable everyone's time is, and that's why we try and make each episode here at All Home Care Matters something that will hopefully matter to you. Today, we are honored to welcome back a very special guest, Roberta Carson, the president and founder of ZaggoCare. Welcome, Roberta.
Thank you, Lance. Thanks for having me.
You're welcome. It's our pleasure. Roberta, let's start for maybe our viewers or listeners who haven't seen or listened to your first interview when you were with us about 6-7 months ago. Let's start with a brief introduction to your story and why you started Zaggo and created the ZaggoCare System.
Sure, thanks. So my son Zachary was diagnosed with a terminal brain tumor when he was 17 years old. Of course, we were completely overwhelmed by this dire prognosis, but we were also pretty overwhelmed by what it took to navigate the medical world and to oversee his care and manage everything that was required. There were new terms we had to learn. We had to make really difficult treatment decisions. We had to share information among all the specialists that we saw. He was on over 20 medications, including injections that we had to give him and keep track of. And there were so many times we said to ourselves, how come we didn't figure this out sooner? Or how come nobody told us this before? And after Zachary died, a lot of people started reaching out to me for advice for navigating the medical world for themselves or a loved one. And I just had this sudden idea that I could start a nonprofit, which I named Zaggo after our son, Zach, and create a product called the ZaggoCare System to help patients and their family caregivers be more engaged in the process to help them get the best outcome and care possible given their situations.
Well, and I think too, it's important to emphasize that it is a nonprofit. And as you shared with us before, the money raised by ZaggoCare goes right to this research foundation. So this isn't just a business for you. This is really a passion and a calling as well.
Yes, definitely. I feel like I'm on a two-pronged mission. I really want to help other people navigate the medical world. I know how much we struggled. I know how hard it was for us. And I also want to raise money for the brain tumor that Zachary had, which is called the DIPG. It's the deadliest of all pediatric cancers. Almost every child, if not every child who gets it, dies from it. And there's very little research being done. So I am passionate about raising money in Zachary's memory.
And I think it's an important thing that you stressed. It's about being organized. So when you say that being organized helped you manage Zach's care, share what exactly that entails and what that means.
Sure. So I started out with little pieces of paper written at various doctor appointments. And thanks to my sister, I quickly got a notebook because I was so overwhelmed. I hadn't even thought of, get a notebook. And I started taking detailed notes at every doctor's appointment, as well as keeping records of things that were happening at home, his symptoms, side effects, things like that. And then I realized I needed a bigger bag because we had all these documents that we were getting from doctors and all these business cards and just all this information, all this paper. And then also we were bringing all these things to the doctors with us because, whenever you go for an appointment, you're there for hours, you're sitting in the waiting room, you're waiting for the labs, etc. So we would take our sweaters and candy and games to play, decks of cards, headphones, things like that. So within about 6 weeks of his diagnosis, I got a pretty big tote bag and dubbed it our chemo bag and just put everything in there. I got a folder for all our documents, a little business card case. And of course, I had my notebook that I had started a few weeks prior to that. And I kept it all together. And whenever we went to a doctor's appointment, or even when we ran out to the emergency room, I just grabbed it and had all the information I needed at my fingertips, organized and ready to be used.
And when you're in that situation, the pressure, the stress, the emotional and physical drain, undoubtedly something's going to be missed or forgotten, right? So when you have it all in that isolated bag or whatever the device is you're using to carry things around in, you at least don't have that extra level of stress or worry. Did I forget something? Did I misplace something? So I think that's crucial. Like you said, you got a tote bag that helped to make sure everything was right there. So when it's time to go, you just grab that. You don't have to then go grab other things, and it's all in one easy location. So having that bag now and starting to put together your tools, how did you use all of the tools?
Well, obviously the notebook is key to any kind of medical journey. It is so important to take notes, and so many people don't take notes, but you have to write down what you hear. You think you're going to remember it, but you don't, or you think you're getting an accurate memory of it, but you don't. So it's so important to take all these detailed notes, but it's also very helpful to take detailed notes at home. So you can tell the doctor when you had a fever, when you were nauseous, when you got your headaches, how you were feeling after you took the medication, what you woke up in the middle of the night throwing up. Write that down. That's important information. So it's so important to have all of the information in one spot in your notebook. Brought it with us to every appointment. You think doctors are speaking to each other and coordinating your care, but they're not. Right. So when you get to a specialist and they say to you, "Why are you here?" you have to know. You can't just say, "Oh, my cardiologist thought I should come," or "the oncologist thought I should be here." You have to say, "Here's what we're worried about. Here are the test results. Here's what we need from you." And if you don't have that information, and you don't have it accurately, it's really going to hamper your care. So we took detailed notes everywhere at home, every medical appointment. Zachary was on a clinical trial, and we get a lot of paperwork with that. We kept that with us. When we went to doctors, they'd never heard of some of these medications. I could pull out the clinical trial information and say, "Oh, here's the new medication that we're trying right now." And it just made it so much easier for doctors to treat Zachary, knowing what was going on with him, what other doctors were saying, what medications everybody was prescribing for Zach, because doctors don't have accurate records of that either. They know what they're prescribing, but they don't always have an accurate record of what other doctors are prescribing, or even over-the-counter medications, which can interfere with prescriptions. So we used it religiously. Had it with us everywhere. I took copious notes. I mean, it was key to helping us navigate the system and getting Zach the best care we could.
Roberta, so as as you went through this journey, being a mother and Zachary's primary caregiver, once you were coming to an end of that journey with Zachary and afterwards, is that when you were inspired to then pick up this, I call it a baton, and carry this mission of yours in creation of Zaggo? Or take us through that process?
Yeah, it was actually kind of interesting. So soon after he died, a lot of people started reaching out to me for their own advice. But then I happened to visit a friend who had surgery, and during this process found out that she had cancer. She thought she was having a prophylactic surgery, but it turned out that she had cancer, and she was completely caught off guard and very ill prepared. And they were taking trash out of the hospital room bucket to take notes on backs of envelopes and on paper towels and just anything they could, write down anywhere they could write it. I'm like, "Oh my, you need help." So I put together my own little version of what I had used and accumulated while Zachary was sick, and I brought it to their home, and I'm like, "Okay, here's what you need to do. Here's what you need to know." And that was really the impetus for I think there's something here. I think there's a market for this. I think people struggle. They don't realize how much they're struggling. And it impacts the level of care you get, and it impacts the quality of your care.
Yeah. When somebody says they've engaged or they're being engaged with a member of a medical team, or when you explain that, the way someone else may explain it may be entirely different than how Roberta explains it. What does it mean to be engaged member of a medical team?
Well, for me, I think it means being part of the process at every step. It is very tempting and easy to just sit back and assume that somebody is watching over this and taking care of you, whether it's your primary care doctor or your oncologist if you have cancer, or a neurologist for stroke recovery. It's just really easy to say, oh, Dr. So-and-so is taking care of that. But the fact is, they're not. They're very, very busy. They don't have time to get on the phone with the specialist that all of their patients are seeing and say, oh, let's chat about Roberta and see what's happening with her. And so it's really important that you don't just sit back and let this happen to you. You have to engage in the process at every stop, at every step. That means at home and at every medical appointment. Firstly, knowledge is power. You cannot bury your head in the sand, as tempting as it is, because you don't want to deal with the seriousness of the condition you're facing. That is only going to harm you in the long run. So you have to get as much knowledge as possible. Secondly, and very importantly, you have to realize that everybody in the process can and could make mistakes. That includes you, your doctor, the pharmacist, the lab technician, the nurse. We're all human beings. And there's not a single human being in the world who doesn't make mistakes, which, you get the wrong sandwich order at the deli. Okay, it's a little annoying, but you get the wrong medication at the hospital, it can be life-threatening. So it's really important to understand that, and that you have a role in that as well, about speaking up if something doesn't seem right. If you get a pill in the hospital that you've never seen before, say, whoa, I never took a blue pill before. Don't just like, oh, okay, and swallow it down and hope it was right. So it's really important to have that understanding about medical errors. And then the third critical thing, I think, in patient engagement is making sure you understand what's happening and what doctors are saying. And people don't understand as well as they think. And studies show that the vast majority of people have a hard time processing and properly using medical information. It comes at you very quickly. They use terms you don't understand. And it's very fast, and it's all over your head. I like to call it the Charlie Brown moment from, back in the cartoon with Charlie Brown, where he heard the teacher saying, wah, wah, wah. You hear bad news, and everything you hear after that is wah, wah, wah.
Yes. Yeah. Absolutely.
You think you have it, but you don't. And there's this very interesting landmark study that showed that by the time people got to the checkout desk, at the front entrance of the medical office, they had forgotten 40 to 80% of what they heard. The more they heard, the higher the percentage that they forgot. But shockingly, of what people said they remembered, half of it was remembered wrong. So if you're not making sure you understand, if you're not taking detailed notes, asking doctors to repeat things, asking doctors to clarify things, and taking it one step further and repeating back to the doctor, oh, I heard you say blah, blah, blah. Is that correct? Is this what you meant? Do I understand this properly? It's going to impact your care and your outcome. There's no doubt about it.
And I think too, yes, absolutely. The memory part, the being overwhelmed when you get bad news or a bad diagnosis or something, that really has caught you off guard. You go in, like your friend, you go in for one thing and then you find something out that is entirely different and a lot more catastrophic. We tell families all the time that we're servicing and helping, don't be intimidated by the doctor. Do not be intimidated. And I think that's a big proponent of this, issue, is people think, and I have nothing but the utmost respect for the healthcare system and the doctors and the staff entirely. So I don't want this to be misperceived, but I think sometimes they go in and the doctor comes in, how are you today? Sometimes they're intimidated to tell them how they really are doing. If it's not, oh, I'm doing good. Or they don't feel the doctor has the patience or the time to really, it's kind of like if you see a friend and, you're at church or at work and you're like, hey, how you doing today? I'm good. I'll joke with people sometimes. I'll say, well, do you really want to know how I'm doing? Or are you just saying hi? And I think, especially for our seniors and, for parents that, are going through maybe a health challenge or a difficult period, they almost feel like, well, they expect the doctor will only want to ask the things that they want to know. And the doctor can't know everything that's going on. So there's going to be questions they may not ask you, but that doesn't mean it's not important or pertinent information. So, I tell families, and, our case managers tell families, if you have something to share with them and you want them to know, you make sure you tell them before they leave the room. Because if they think everything is fine, they're just going to get up and leave. And it's not that they may not necessarily not have the time for you, but if there's nothing for them to spend time on, they're just going to move on. The flip side of that is, if the doctor does tell you things that you don't know, you're not sure about, I tell families kind of like what you're doing with, this important ZaggoCare system, write it down, ask them to write it down. Or if it's an elderly person and, maybe their, comprehension isn't that good, or they're a lay person and they're not familiar with these healthcare terms, which most people are not, ask the doctor if they can write it down for you or summarize it about your visit that day. And don't let them leave until you fully understand what they're telling you or trying to explain. If they're adding a new medication and then they say, but your other pill, I want you to, take it half the time or whatever, you need that written down. Because if you don't have an advocate with you, or you don't have a ZaggoCare system, very bad things can happen as a result of that, and I think it just goes back to the doctors are there to serve the patients. First, do no harm, And yes, I realize some of them feel like they're in and out in just minutes or seconds even. Just approach them and say, look, wait, you can't leave yet because I don't understand this. And they want to make sure you understand because they don't want to cause any more difficulties for you. And, they're trying to get you better, or they want to explain something. Though most doctors are going to be more than happy to sit down until you have a clear, good understanding about it. And if you have something like the ZaggoCare system, they can even write it in the book for you, or you can write it down while they're explaining it. It might be better if you write it down because we all know how doctors' handwriting is, and you might not be able to read it and you'll be calling back anyways. But, I think it's important that people, when you have that audience with the doctor and you have them in the room with you, you make sure that you feel all of your questions have been answered, all of your explanations have been given, and anything else, address it while they're with you. Because I can't tell you how many times a family says, oh, we got home and we just realized this or we just realized that. And I tell people also, it's a good idea if you're afraid you're going to forget when you get in there, kind of like the memory example you gave, make a little list before you go to your appointment. Have it all on paper and then just check it off, as you go through it. Because, some of these specialists and doctors, it might be 3, 4 or months longer before you get to see them again. And, I know recently, Roberta, we had a client, and she had to see a hand specialist because she had a horrific fall and shattered several bones in her hand. And the specialist that she had to go see, because they did not want to do surgery because of how intensely involved and invasive it was going to be with rods and pins and screws, they wanted to just do the casting and, very intense therapy on it. And, she's making a great recovery. However, her hand specialist was at like 4 or 5 different campuses throughout the week. So he might be at her office once a week, and then the rest of the week he's at 3 or 4 different campuses. And she said, well, I can't call because he's not there. I said, well, no, this is what you need to do. Call the office that you go to. They can then either give you the number for the campus he's at that day, or they'll take your message, pass it on to him, and then he will get back to you, or one of his nurses or staff will get back to you with an answer to your question. They were too intimidated to even call the office because they said, well, he's not there. And there's a lot of other ways that, you can get your answer rather than just talking directly to the doctor, and I think that's a big part of it. So before you go and show us the ZaggoCare system, I want you to explain who could benefit from the ZaggoCare system, because I know when we talked previously, and we've talked several times, not just on the show, one of the misconceptions that sometimes can happen is people will hear your story about Zachary and they will start identifying ZaggoCare as a pediatric or, something for a child. And that's not what ZaggoCare system is at all. This is for anybody, whether it's for themselves or for a loved one that they're helping, regardless of age, regardless of condition, to help them manage these difficulties. So share that with us so viewers and listeners can have a better, clearer picture.
Right. Thank you, Lance. That is very true. So the product is designed to help any patient or family caregiver dealing with any kind of serious medical condition, and that includes injuries as well as illnesses. So it's anything that has happened to you or your loved one that requires ongoing medical care, whether you've been recently diagnosed or you've been dealing with a chronic condition for a long time. So we're talking, of course, things like cancer, because, obviously I made it after my experience with Zachary and his cancer, but also things like diabetes and multiple sclerosis, Parkinson's disease, head trauma, spinal trauma, severe burns, liver disorders, kidney disorders. There's an endless list of diseases and medical conditions for which people can take advantage of this. Certainly, the sooner after diagnosis or traumatic event, the better, but it's almost never too late, because as you are dealing with a medical condition, even Zachary, who was diagnosed with a terminal cancer, he wasn't really that sick at the beginning. He was taking one medication that had some side effects, but it was manageable. But then as time went on and the medication, the very strong chemo, started to have an impact on other organs and other body elements, by the end, he was on over 20 medications. He was completely paralyzed. He couldn't talk, he couldn't swallow, he couldn't move. And it just became so complicated to manage his care. So yes, the sooner the better, but unless it's the very end of life, it's never too late either. And I do want to add that ZaggoCare makes a great gift. Many of the people who buy it on our website buy it for somebody else, whether it's a friend, a coworker, someone you know from church or temple, or a neighbor, or of course a family member, anybody who's going through something serious. A lot of people think, oh, I'll send some flowers over, maybe I'll send over a chicken dinner. It's a little basket of muffins, what have you. But this is a gift that's fairly inexpensive, and it keeps on giving. It helps somebody get the best care and outcome possible. And there's no better gift.
Well, and I just want to point out, after you joined us the first time, we did make a donation to ZaggoCare, and we received the ZaggoCare System. And one of the things I told you, aside from how important all the tools and resources are that comes with it, I thought for our side, because we deal with families and provide, help for them so that they can safely age in place, and, whether it's dementia they're dealing with, strokes, cancers, and like you said, any number of conditions and situations. I think one of the key things that you have provided in there, and again, I want to emphasize, this doesn't take away from all the other resources because they're all remarkable and very much needed, is you also provide a book. And I want you to talk just briefly about the book, because I think, it's one thing to, have resources, but it's another thing to understand how to implement the resources and how to care for another person. Because I don't know, maybe you did, but a lot of people that we find that we're helping, they had no prior knowledge or understanding or background in healthcare or caregiving. And all of a sudden one day, they're now a caregiver for another person. And that in and of itself can be very overwhelming and, really intimidating. And so you provide this book, and I want you to talk briefly about the book, and you're going to hold it up for us.
I am. Yes. So first of all, Lance, it's so true. Whether you're a new patient or a new family caregiver, nobody is prepared for that. You're fine one day, and the next day you get this terrible news, or you suffer a tragic accident, and your whole life changes. And you don't know what to do. And really importantly, you don't know what you don't know.
Yes.
And you don't even know what questions you ask. You don't know what to say, what to do. So as you were talking about, the central element, the most important part of the ZaggoCare system is our ZaggoCare guide. It's 120 pages of very easy to understand information, and a few cartoons, because I think it's really important to maintain your sense of humor no matter what is going on, because it makes everything, even tragic things, a little more bearable. So the guide tells you everything you need to know that nobody has the time to tell you, that nobody is going to sit down and say, okay, here's what you do through this process. Here's how you navigate. So things like questions that you might not think to ask, how to organize your medical information, how to take notes, what kinds of things to write down in the doctor's office, how to coordinate your care among the specialists you're going to see, even the importance of making sure that every healthcare professional washes their hands in front of you before they touch you. And of course, something that you were talking about before, and people being intimidated by doctors, which I wholeheartedly agree with everything you expressed. Really important thing is helping people understand the importance and giving them permission to speak up if something is wrong.
Right.
That is critical. You don't want to get home and go, you know what? I don't know why he was talking about my head, because it's really my back pain that is bothering me. Or, he said I should do this, but that doesn't make any sense to me at all. You have to speak up. So through the guide, it's a step-by-step. It's mostly bullets. It's, not my personal story, although that is why I created it. It's not part of this process. So for instance, we have a lot of information on medication. Medication is a really important part of most people's medical journey. Most people take medication, but it's so important that you take the medication correctly, at the right time, in the right way. And part of that is knowing what questions to ask your doctor about your medications. If they say to you, take this 3 times a day, what does that mean? Is that breakfast, lunch, and dinner? Is that every 8 hours? Do you need to set your alarm for 6 a.m. to take it?
Is it before food or after food?
Yeah. Right. What foods should you maybe avoid? What if you can't swallow it? Can you crush it or not? Can you cut it in half? All these questions that people don't think to ask. And so over 50% of people and adults in the United States don't take their medication as prescribed. So in the book, we walk you through what questions to ask when you're getting it, how to make sure you get the right medication at the pharmacy, because unfortunately, somewhere between 15 to 20% of medications are misfilled at the pharmacy. These people are well-educated, really smart, driven professionals, but they're really busy and it's very easy to make mistakes. A lot of medications sound very similar and it's easy to pick the wrong one or the wrong dosage. And then we give you advice on how to make sure you're following your regimen at home, how to organize your medication, how to set up reminders, and how to make sure you're staying on track. So, that's just one part of the book, but it's really an important part.
Crucial part.
Other parts include things like what kinds of questions to ask about your diagnosis, how to reduce your risk of diagnostic error, how to make a treatment decision, how to get help from your community. It's really hard to do this by yourself. Yeah. And we encourage people to reach out to their community, whether it's neighbors, friends, family, a church group, a temple group, a support group online. Just don't try to do this by yourself. And we encourage people and help them figure out how to do that. And then if you're really, really in a rush, the beginning of the guidebook is a couple of pages of quick tips. Like, these are the most important things to know. Just read these first few pages. And then when you have a little more time, you can dig in and get more information. So it's just trying to help people be engaged in the process, communicate more effectively with their doctors, and get the most out of every medical appointment.
Now, I know you got the tote there, and I think it's such a wonderful tote. It's very lightweight. Go through the tote with us.
Okay, so everything, including the guidebook, and I'll show you everything else in a minute, comes in our ZaggoCare tote. It's lightweight, as Lance just mentioned. It's durable, it's water resistant, and it's filled with all the pockets and zippers to make everything convenient. So the main compartment is zipped. So if you throw it in your car or you have it on the floor at a doctor's office or in the hospital, nothing's going to fall out. And then we have drink holders on the side. We have a Velcro tab pocket on the outside if you have something that you want to just get to quickly. And then it comes with the carrying attached straps and a detachable, adjustable shoulder strap. So depending on how you want to carry it, if you want to put it over your shoulder or crossbody, or even hang it on the back of a wheelchair, there's a wide variety of ways you can handle it to make it easier for you. And then inside, we also have another little storage pocket. So it's really convenient. It's easy to keep everything together, and it's big enough to keep not only all of our organizational tools, including our guidebook and the tools I'll show you in a minute, but everything else you need when you go to the hospital. I was referring to this earlier. It's always freezing in there no matter what the temperature is outside. So we all had sweaters little lightweight sweaters that we kept in our bag. And we had headphones and phone chargers and magazines and playing cards, and snacks and chocolate, because I think every situation needs chocolate, and kept it all in the bag together. So if we were at home and something happened to Zachary, I'm like, oh, I have to write that down. I would take out the notebook, I would write it down, I'd put it back in the bag. And our motto is grab it and go. So you have everything together, you're ready to go for a scheduled appointment, or as I mentioned earlier, off to the emergency room. You have everything you need, your comfort items, your history, your paperwork, the list of questions in the book, everything you need to be engaged and effective in the process.
That's remarkable.
So can I show you some of the other tools?
I was going to say, I know there's some more goodies in the bag, so let's go through those.
Okay, so the next thing is our notebook. It's just a 6x9-inch notebook, just unscripted pages, blank pages, although the middle does have a little pocket where you can put some documents if you want. The reason we kept it blank, the pages blank, is because you never know how much information you're going to write down, and you never know what you're going to want to write down. Sometimes you might write down 3 sentences. In other appointments, you might write 4 pages worth of notes. So we want to make it easy for people to keep their notes organized. And, in the guidebook, we tell you what to write down, as I said before, at home, and what to keep track of in the doctor's. What to write down in the doctor's office and what to keep track at home. Sorry about that.
No, that's okay.
And the next thing we have is our accordion folder. You can see here, plenty of
Very
sections.
important.
Yeah, so important. And we have our tabs that have stuck under that you can use to personalize what you have in here. And you can use this to keep all your documents organized. And, a lot of people think, in today's day and age, everything's electronic. I don't need anything for my paperwork. Unfortunately, in medicine, nothing could be further from the truth. There is still so much paper in medicine. Yeah. You get your handouts from your doctor after an appointment, which is great to have because it's their recap of what happened. You get lab results. You might have clinical trial data, physical therapy instructions, nutritionist guidelines. There's just so much paper in medicine still. And it's really important that you have it and that you keep it with you and that it's organized. So by using our accordion folder with our little elastic shut to keep everything secure and safe inside, you have everything organized and at your fingertips. So if you go in to see a specialist and they say, when's the last time you had dialysis? Or what did those kidney tests show? You're not like, I don't know. You're like, let me see. And you pull it out and you have it at your fingertips. You're ready to go.
Yeah, wonderful.
Really important. And then the last 2 things, we have what I call just our little pouch, which we made bright green so it doesn't get lost in the bottom of the bag. And this is for all the little things that you want in your bag, but you don't want to lose track of. Your pens, maybe hand lotion. I put my little chocolates in here when I was doing this with Zachary, tissues, maybe even some medications, just anything you might want, and you just zip it up and it keeps it secure in the bottom so you're never digging through looking for a pen when it's time to write down your notes. And then the last thing is a little business card case, just a simple leather business card case. I strongly encourage everybody to get a business card of everybody on your medical team and keep it with you, and even write notes on the back about which doctor this is, or what the name of the receptionist, or what their hours are, or what their email is, or what have you. Of course, you can keep this information in your phone, and a lot of people do. But it's important to have the cards as a backup because your phone can break. The battery can die. You can lose it. Things happen to telephones. It crashes. That's it. It's broken. And then all of a sudden, you don't remember who your doctor is. You don't remember who that specialist is. You don't remember their phone number, their email address. It's, of course, when things are going great in your life and you don't have any stress, it's really easy to keep track of all these things. But when you're dealing with a serious medical condition, all of a sudden, everything is hard. You're completely overwhelmed by everything in your life. And that includes remembering your doctors.
Absolutely.
Yeah.
when we spoke originally, and we were discussing more or less your journey as caring for Zachary, and it kind of ended with talking about your creation of ZaggoCare, you know, and I think this is important to point out to our listeners and viewers, visiting the ZaggoCare website, which we'll have the links and all of that in our show notes and descriptions. But ZaggoCare has been recognized, and yourself has been recognized quite a few times for the importance of this system, because it's not something common. A lot of people aren't thinking about this side of it when they're first going through it. Kind of like when with you and Zachary, it wasn't until your sister gave you a notebook. So in a way, you're trying to provide to people what I think it's fair to say you wish you had at the beginning. And I think that can't be stressed enough. And it's just remarkable of how ZaggoCare has been recognized, and you've been recognized for really bringing a spotlight to this important issue. It's really planning for the caregiving journey. And again, we want to stress, it's not just for a child. It could be for yourself. It could be for a spouse, a parent, a loved one. And, and they don't necessarily even have to have some terminal illness. It could just be, dad no longer drives and now I'm having to take him to his appointments. Otherwise, he's fairly healthy. But you could still use this resource to keep track of all those things, because you're not going to remember everything. Like you said, once you leave that appointment, or, maybe you have to help, maybe you have a caregiver taking care of a loved one, and your loved one isn't able to really advocate for themselves or explain things for themselves. So you'll have ZaggoCare to keep track of the medications, and, because if a new caregiver has to come and help out, or maybe a brother or a sister is going to take over for a couple of weeks to give you a break, well, now they're coming into this situation totally brand new, and they're going to have to get up to speed. So there's just so many aspects to which ZaggoCare can help prevent accidents, or, medication situations, or just any number of things. Or, there's an emergency. We need to get a hold of dad's, dialysis doctor. Well, who is it? Nobody knows. Well, you can go right to the Zaggo system and there he is, or he or she is. So I just think it's remarkable what you're doing. And, I think it's tremendous. Much like with all Home Care Matters, we're trying to provide resources and information to families and listeners and viewers that they may not know about, right? Much like yourself again. And, if we can help get Zaggo system into a family home to help prevent a possible situation down the road, or give them some information that they're not aware of, we're happy to do it. Just like with you, you're doing this as a nonprofit, and the proceeds go right to cancer research for this, rare brain cancer or tumors. And I just think it's more about the people than just a business. And I think more people need to be aware of, great resources like ZaggoCare, that you're doing it from your heart. You're doing it, and we talked about this the last time, you were on with us. As tragic and horrific and incomprehensible for myself to know what you had to go through with Zachary, it brings a better light to it, I guess, in a way, with how you're honoring his memory and the countless families that you're now able to help, so that they may have a little easier journey than what you had to go through. And it's all in, Zachary's memory, and, the proceeds are going to help hopefully find a cure for this cancer, so another mother or father won't have to go through what you had to go through on your journey with Zachary. So I just applaud you and commend you. And I can't say enough wonderful things about how remarkable of a person you are, but even as remarkable that ZaggoCare System is. And I hope our viewers and listeners will, go to the website. They can read more about it. They can see all of the awards and recognition that ZaggoCare and yourself have achieved. But more importantly, they will hopefully get the ZaggoCare system, so that when that day comes, or maybe that day is already there for some, that it will help ease some of their burden and make it a little bit easier. And, that's the bottom line, is just being able to help these families that are going through what so many families and yourself have gone through. Just take a little bit off of them just to make it a little smoother journey. I think it should be achieved and accomplished through ZaggoCare.
Thank you, Lance. That's quite nice of you. And yeah, I mean, the whole idea was to provide the information and the organizational tools that people need to get the best care and outcome possible. I mean, obviously, we're not guaranteeing that you're going to be cured of cancer or that some miracle cure is around the corner, but study after study shows that people who are engaged in the process and communicate well with their doctors have the best chances and the more likely to have good outcomes than those who don't.
And if nothing else, it makes it a little bit more manageable as they're going through it. And I think that's key because, statistically, so many family caregivers have experienced burnout. They suffer from their own mental, emotional, and physical breakdown because it is so tremendously overwhelming. Because a lot of them are doing it alone, or they may have help, but help only goes so far. Usually it's one person with their loved one in that doctor's office, or it's that one person that gets the call at 11 o'clock, I'm really sick, or I have fallen, I need you to come over, any number of things. And, we were just talking to somebody about this the other day. Family caregivers are not professional caregivers. And what I mean by that is two things. One, they don't have an end of the shift. So at, 7, 6, or 5 in the evening, they go home and they don't have to think about it until the next day when they go back to work. Family caregivers, they have it 24 hours a day. They may not be there 24 hours a day, but that is on their mind and in front of them 24 hours a day. But they also have the emotional and the physical and the mental aspect to it that professional caregivers don't necessarily carry with them because they don't have that personal connection. It's not family, though you would like to think all professional caregivers have the heart for it, but it's a different component. It's in a way, it's like the babysitter. The babysitter loves the children, they love the kids, but they're not going to be up with them at 1 o'clock in the morning if they're sick. That doesn't mean they care less. It just means they don't have that aspect of it. And so family caregivers, they're kind of getting it from both sides, and they need to know that they have that support. They have these resources like ZaggoCare, and then they're not alone. They're not alone. They're not going through this by themselves. And there's wonderful resources like ZaggoCare that are trying to, in their own way, make it a little bit easier for them. And I just think it's tremendous the work you're doing. And I applaud you, Roberta.
Thank you. It's obviously great what you're doing, and I'm honored to be a part of it.
Absolutely. Well, we're honored to have you. And we will have all the information up on our show notes and in our summary. And I think you even provided us with a short little animated video and a testimony as well. And that will follow us right here at the end of the show so people can watch and see a little bit more of ZaggoCare. And if anyone has any questions, they can reach out to you on the website as well. And hopefully they will do so. I just want to thank you again for joining us and keep up the great work.
Thank you. You too.
My name is Lori Krasner, and my story is one of Parkinson's disease. My husband was diagnosed in 2004 and managed quite well for a number of years until 2009, when he had an adverse response to his medication. In the midst of this turmoil, it provided an incredible amount of opportunity to have some control. My life was just spiraling out of control. The system provides an opportunity to track information. You begin to understand that even the most, what you might consider the most insignificant detail may actually be very, very important going forward. At some point in the future, a doctor may ask about something that you never thought was important. So it gives you that opportunity and directs you and guides you to a certain way of thinking. With the ZaggoCare chart, there was actually a template that I was able to adapt to my own needs and to his, and that was amazingly helpful. It really helped me to keep him on track. And when you've got a situation where someone is whose life is depending upon medication and the right dosage and the right timing, you need to have some sense of organization. Otherwise, everything becomes overwhelming, and the possibility of not being able to cope is quite real. But the ZaggoCare system really helped me to cope because it put some control in my hands.
Are you a patient or family caregiver? If so, you know the challenges. We don't know what we don't know. There's so much to learn and so many decisions to make. We all want to receive the best healthcare and outcome possible, but that's hard without clear guidance. Consider this. Over 50% of Americans don't take their medication as prescribed, and 90% of adults have trouble understanding and following health information. Fortunately, ZaggoCare can help. ZaggoCare is an innovative, award-winning product that helps patients get the best possible healthcare and outcome. Our guidebook with hundreds of easy-to-follow tips and our organizational tools help patients and family caregivers be more informed and organized. So, if you are a patient or a family caregiver, order ZaggoCare and experience the difference. And if you have a friend who is managing a serious illness or injury, send them ZaggoCare. It's a meaningful gift that says, I want to help you be as healthy as possible. Get the ZaggoCare system today.
Thank you for joining us today at All Home Care Matters. All Home Care Matters is here to help families as they navigate these long-term care issues. We invite you to visit us at allhomecarematters.com, where there's a private, secure, fillable form where you can give us questions, feedback, or if you have show ideas. Every form is read and responded to. And please, if you know someone who could benefit from this episode, please make sure to share it with them. And remember, you can listen to the show on any of your favorite podcast streaming platforms or watch the show on our official YouTube channel. Just make sure to hit that subscribe button so that you never miss an episode. We would also like to thank again Roberta Carson for joining us today to discuss ZaggoCare. Thank you so much, and we look forward to seeing you next time here at All Home Care Matters.
Thank you for joining us today. We look forward to you joining us again on another episode of All Home Care Matters. To learn more about the show and to connect with us, visit us at allhomecarematters.com.